So, okay. Hi, my name is Laura Zelenak. I'm a health educator with Marshfield Clinic Health System Center for Community Health Advancement, and we work to improve community health. And I'm back with Dr. Hartwig today, who's the creator of the BEST Universal Screening Tool, and BEST stands for Behavioral, Emotional, Social Traits. This is the 8th school year that Marshfield Clinic Health System and Security Health Plan, which is part of the Marshfield Clinic Health System, have been supporting school districts in working with Dr. Hartwig and using the BEST program to support the behavioral health of their students. This is the second conversation we're having about supporting kids and giving them the best chance for success in school. And you can find our first video on the Marshfield Clinic Health System Center for Community Health Advancement Facebook page. Thanks so much for taking the time to chat with me again today, Dr. Hartwig.
Great to be back, Laura. I appreciate it very much. Good to see you again. Thank you for having me.
Thank you. Good to see you too.
Good.
So today we're going to talk about the importance of physical health, and I think we could talk for a really long time about that. That's a big topic. So can you give us an idea of what people, parents and caregivers should focus on when we think about physical health and helping our students succeed?
Yeah, it's really a very important part of the discussion. You know, when kids get into school, we have many different interventions and supports that we provide for them. But really, to get ready for school, I think there's 3 basic areas that I think we could focus on for families to help kids become more engaged in the school environment. The first is sleep pattern issues. It's very interesting when you look at the whole process that children who are disengaged in school sometimes are just tired. And ultimately they struggle with being able to focus, causes some levels of irritability. And I think that ultimately that can affect their ability to respond in an academic environment in a way we'd like them to be involved in. The other area is the eating habits. I think that we want to have children eat healthily in a healthy manner. And I think what's important regarding this is to have routines and structures for families. One of the things that's happened over the last 6 months that many families have reported to me, and classroom teachers, by the way, in the trainings we've done on BEST, have commented at how their families are getting together and cooking dinners, and that they have a routine and a structure for this. You know, that 5 o'clock is the time to eat and everybody sits down together, when in the past they were going everywhere. That sometimes they would, they were taking somebody to soccer, they were taking somebody to dance or whatever it might be. And as a result of that, they were always on the run and they were grabbing fast food and that really not being able to sit down as a family and catch up on different things and really, frankly, make that social connection. And the third thing, and I think this is a technology issue as well as a life experience, is that physical activity is absolutely an integral part of everything we talk about here. All of these things, sleeping, eating, and physical activity, are interrelated in ways that are very, very important. In order to sleep well, you have to be physically active during the day. And when you are physically active, you eat better, or you can make better choices because you can also prepare for those kind of opportunities if you plan and have structure. One of the things, when you look at the physical activity, for example, I think many children are really kind of stuck into this process of the technology and the devices. And oftentimes when they come home from school, prior to the situation we've all experienced with COVID, that they would come home and then they would turn on a device and not get outside. And while the school may provide some activity, I think that the general nature of what play is about and activity is something we ought to build into our schedule. So I think those 3 things are very, very important, and I think they help kids be ready to learn.
Great. As a person with a nutrition background, I love hearing that families are having dinner together. There's a lot of evidence for that being good for kids.
Yeah, it is. And something else, another side effect to that was also the physical activity. Turns out that all the times that people were doing Zoom and things like that, people got kind of tired of the virtualness of all the situations. So they were also encouraging their kids to go out and play and do things outside. And it was very nice to hear that too.
Yeah, cool. Okay, so we've got physical activity, sleep, and eating, and that gives us a broad sense of what to focus on. I think parents and caregivers would be interested to have some basic guidance around those areas. So let's say there's a child that's getting everything they need in these 3 areas. What does that look like for that child?
Yeah, it's a great question. By the way, we have a great resource available too that I hope you can make available for the families. It's healthychildren.org, and it's a very nicely written document that's available to anybody to look at. But let's talk about sleep for just a minute. It's surprising the guidelines for the level of sleep that kids need, that I think most of us would think, wow, that seems like an awful lot. But if you even think like let's take a preschooler as an example, an ideal day, or excuse me, a grade schooler, 9 to 12 hours of sleep time is suggested. And so there's a range. And really, when you think about the fact that all of us need different levels of sleep, we're talking about a range. And so we need to find a way as best we can in our structures to be able to have kids to have time to sleep. Secondly, the structured meal times. I think it's important. You know, there's a lot of things that are going on, hopefully in the school, that they're able to eat their lunch in a timely fashion and provide that. But kids need a breakfast before they go to school, and they need a time to eat healthy food. And I think instead of choosing quick snack things that maybe are maybe more likable, to take a look at fruit and milk, and even a sandwich or a cup of soup is easy to put together for families. And the physical activity for a grade schooler, we're talking at least 60 minutes a day, maybe a little bit more than that, you know, outside doing something that's more than just coming at home and sitting down, and getting the kid to be engaged in an activity like that. I think, again, is something that benefits all aspects of their behavioral health as well. You sleep well, you eat well, you engage in physical activity. It can manage your emotions and your feelings and help you self-regulate.
Those are all things that are take place throughout a whole day of every person's life. There's such a big part of everyone's life. And we know from science that a lot of adults aren't getting what they need in these areas. So if I were a parent, I might be a little overwhelmed in thinking how I'm going to get to a place where I'm meeting my own needs in those areas, and then create an environment where my child's getting those needs met as well. What's your advice for getting started? Let's say there's a room for improvement in all areas of a specific family's life. You know, where's a good first step? Where's a good place to start?
You know, that's also a very great question, because you don't want to overwhelm yourself. Sometimes it just seems impossible to attack it. So here's a couple of suggestions. First of all, there's no behavioral pattern that you or I or anybody engages in that we can't take a little time to collect a little bit data about ourselves. So for example, for a couple of days, what's your average sleep patterns? You know, how often do you sleep on Monday, Tuesday, Wednesday? And kind of get an average. Do the same thing about how often are you together as a family to eat? And what are the things you eat? So establish a baseline. And if you imagine this in terms of problem solving, don't worry about what's happened in the past, but where would you like to be and where are you at? And then to incrementally plan on how you might change that. You know, again, we were really literally forced to have predictable structures for meal times based on COVID, but now we have an opportunity to actually build that into part of our day. But I say start small. Maybe you can't have a family meal every night together. Well, start out with 2 nights a week. Try something that's doable so that you can be reinforced by the fact you've done it. And the next you can build on it. Maybe the next couple of weeks, it'll be 3 days or whatever it might be. And the same thing with physical activity. You know, it's interesting. People at the YMCA here, we always see an influx of people in January, you know, because they've got all these new rules. And people by February, they're not there any longer because they push too hard. They expect too much. Start small. If 60 minutes is your goal, start very small and build on that. I had a Phi Ed teacher in high school that said to me one time, you know, he said, you need to make time to have time. And I think when you define that and establish priorities, there are things you can do to juggle to really focus on that. And I think we've learned that in the last couple of months as well. So I think that's how I would look at it. Start small, work incrementally, and build on your small successes over a period of time.
Well, that is really great information, really great advice. Starting small is going to be doable, and it'll help people make changes. Well, thank you so much for your time today and for joining me. I have really enjoyed making these videos with you. And we have another one planned. So next time we're going to talk about the significance of having intentional one-on-one parent-child time. So I'm really looking forward to that as well.
Great. Well, I enjoy it too. And thanks a lot for taking the time and also for inviting me to participate. As I really appreciate it. You take good care, Laura.
Thanks. You too, Dr. Hartwig.
Bye-bye.
And watch our Facebook page for upcoming posts. And if you want to stay connected with all the work we're doing in community health, you can follow our page. It's at mchs.ccha. Thanks for watching, everyone, and have a great day.